We're back with two key figures in Mercy's leadership, President and CEO, Dr. David Maine, and Executive Chair of the Board, Sister Helen Amos. Earlier this year, we witnessed the passing of Pope Francis at the age of 88. Dr. Maine, in a statement shared with the Mercy family, you noted that Pope Francis embodied, quote, the principles of compassion, humility, and service to the most vulnerable. Through his papacy, he championed mercy, healing, and dignity for all people, especially the sick and the suffering. How do you both see the Pope's legacy intertwining with the Mercy mission, and why is this more important now than ever?
Well, I think, Dan, my statement really says it. He represents values of mercy, and that was important. That was important not just for our Mercy community, but for our world. And I think he left an indelible mark, and his loss is significant to the community.
I think one of the things I remember very clearly is when he was first introduced to the world, he said, "Pray for me, I'm a sinner." And I think, we can all take a message from that. We all have our faults, and one of the best things we can do is know ourselves, know where we're weak, try each day to be better. So he's got it was a timeless message.
Mm-hmm.
There seems to be more concern now about the state of health care, access to health care, a lot in the news about Medicare and Medicaid. What's your opinion? Will there be systemic change to our healthcare system at some point, do you think?
We have a strategic plan that we take a considerable amount of time with our medical staff, with our leaders, and with our governance. And that plan outlines fundamentals that we focus on: our people, how we grow, stewardship, quality, and those strategies and the tactics behind those are meant to be able to cut through any change in healthcare policy, because inevitably there's always evolution of policy. Every time there's a change in the administration, whether it be here in the state or at the federal level, we take a step back and we evaluate the potential effects on policy, and with that in mind, I think we have fidelity to our plan. We adapt, and as an independent organization, we're very nimble, and so we're able to adapt. But I think change is inevitable to some degree. I hope, and we strive for the ability to make sure that every Marylander has access to care, access to the very best care when they need, where they need. And at the end of the day, as long as the policies fit within our ability to do that, we'll be okay.
Sister?
You can count me as a person who doesn't expect any wildly systemic changes. The healthcare arena is very, very complicated. And I think it can be touched here and there, and that's the most I expect to see in my lifetime.
Now, we've talked a little bit about Mercy, the Mercy mission, how we see it. How do you think Mercy is viewed by the Baltimore community, by the people who live here, by local businesses, the city officials we work with?
Well, take our capital campaign as an example. I think the fact that before we ever went public with the campaign, we had already reached our initial goal of $75 million. And I think that says a lot about what the community at large thinks about Mercy, and what the corporate community in particular thinks about Mercy.
To me, the litmus test of what your community thinks about you in respect to healthcare is whether they come there for their healthcare or they bring their loved ones there for their healthcare. And so we've seen tremendous growth in all of our ambulatory sites that surround the Beltway, as well as here in Baltimore. And for the reasons that I hope we were clear about earlier, the compassion and care delivery, clinical excellence, empathy in that community of compassionate care. So I think that's one sign. Another sign is we had a community celebration here after our 150th anniversary, and that was an opportunity to celebrate not just with our Mercy family, but with the greater community. And we had thousands here. And it was just, it was evidence of what we mean to the city and what the city means to us. And we rely on each other, and we're proud to be in the position we are here in Baltimore City, serving our greater Baltimore community.
150 years. So what's next for Mercy?
151.
We're in the midst of 151, are we not?
Yeah. Well, one thing I'm especially looking forward to is our new initiatives in regard to training the nursing workforce of the future. Mercy has been in the business of educating nurses for a long, long time. Way back, shortly after the founding of the hospital, in 1899 to be exact, that's when the sisters decided to start a school of nursing. And many, many nurses, including many, many Sisters of Mercy, went through that school of nursing and spent their entire professional careers as Mercy nurses. We closed the school in 1974, but we have continued to be involved in the education of the nursing workforce, and we have new initiatives coming, which we're very excited about.
Can you speak about any of those?
Well, Dr. May can speak about that.
Do we
Just
have
a hint?
Do we have 2.5 hours? I think on the education front, we started talking about our people, and so we are investing in a clinical simulation lab to support our nurses and other frontline clinical staff, with lots of help from supporters who see the value of that. But when I think about tomorrow, I think about the very deliberate, intentional growth in areas where there is need and where we can deliver value. In Mercy, we don't do everything. We always try to deliver high quality, high value care and be the very best at what we do. And so we'll continue that very deliberate, intentional effort around that, growing where communities need the support and where we can deliver on that promise. And I think that discipline is critically important to us. It's been key to our success, and we feel blessed to be able to deliver on that and have the responsibility to do so.
And making that connection to the community, we've certainly seen that, we see it many different ways, but in particular, Mercy's expansion, as we say, circling the Beltway with the Mercy Personal Physician sites at Hunt Valley now, Ellicott City, in addition to more established sites from Lutherville and Overly. Of course, Glen Burnie too. It's like where is Mercy going to wind up setting up shop next? But it certainly, I think, is a really nice approach, because it allows people who might not be geographically inclined to have access or come into the city, that they can still get that Mercy quality of care, see these Mercy physicians. Do you think that really builds in well into the overall plan in terms of Mercy's connection to the community?
I think you have to keep care easy. You have to make it as easy as possible, and making sure that access is available within communities is part and parcel with that. I think it's an imperative. It's something that we'll continue to do in a very, again, deliberate way. And then we have our hospital, our beautiful hospital, to deliver acute care services at the highest level, and we're there for that as well. And you can see how both have grown as you'd expect as the population that we care for has grown.
We pay a lot of attention to the fact that people come in here and they say, you feel something different when you walk into this hospital. And so, so many people say it that you have to pay attention. But one of the things that we're trying to pay attention to is some of our satellite clinical sites around the Beltway, some of those staff never come to the hospital. So do they practice merciful behavior, which you were asking me about before? Do they practice merciful behavior in the same way that people recognize here? And that's something that we're giving a lot of attention to, supporting the staff so that they also are imbued with that same sense of building a compassionate community.
I think ultimately it comes down to whether you're an employee of Mercy or you're a patient of Mercy. People want to feel that they're being heard. whether it's a patient talking about their medical condition or an employee talking about how they can excel in their position and grow. Do you feel that we're good listeners here at Mercy? Do we hear our patients and employees?
I think you said it well, Dan. People want to be heard. They want to be seen. And whether you're an employee or someone receiving care. And I think we deliver on that. Are we perfect always? No. But we talk about this as an organization. If we fall short, hopefully there's someone to the left or right that tells you is there to pick you up and push it in the right direction. And that's an organizational culture that you want, because we are all human. People are people, and we're not infallible. But we know that we want to provide the best care. We're very focused on that, and we feel really good about the strength of the Mercy family to continue to push us forward with that in mind, and that we're always there for each other.
I remember your predecessor used to say that the Mercy was a combination of two good things: the academic level institution in terms of healthcare delivery, but in a community hospital setting. So you have that sense of, I'm in an institution where I'm being heard, that I matter, that I'm important, but I'm also having access to these incredible physicians and nurses and clinicians who have national and some international reputations for the work that they do. How do we come about this formula? How were we able to pull this off?
That work started many decades ago. You get great doctors and you surround them with great people to facilitate the care. Let the doctors doctor. Let the support team support them in doing that in a way that makes sense, that is sustainable, and then go from there. At the end of the day, you always have to have great providers, and we stay focused on that, and we're blessed with an incredible medical staff that has stayed true to that, and we've stayed true to that in our thought about how we have, when providers join us, we want them to have all those values of mercy and convey those to everyone around them, and it's a formula that works, and we're sticking to it.
The phrase that occurs to me is organic growth. I think that, we didn't strive to become part of a multi-hospital system. We have one hospital, we have one mission, and we try to not outgrow ourselves, but only grow as we're able to attract staff, doctors and staff, and invest in them so that they are carrying the Mercy spirit with them as we grow.
I used to call Mercy the little hospital that could. Because I had seen some research in looking at hospital trends, and at the time, the research I was reviewing, it said, well, hospitals were basically falling into a couple of different categories. Those that were closing, like our own neighbor church hospital that closed its doors after 140 years. They were merging, becoming parts of big mega systems, as you mentioned, Sister, or they were trying to align with one or two other hospitals. But the message was the independent single hospital isn't going to make it. And it's like, well, that's been proven wrong, wouldn't you say?
Yeah, yes, right.
Our independence is our greatest strength. It allows us to be nimble, to pivot where need be, and time again, I think that's been shown. So independence is central to who we are.
Thank you both.
Thank you.
And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. Until next time, may the road rise up to meet you.